Hello again, and once again, welcome to GBMC Facebook Live. I'm Don Scott, and with me today is Hillary Scott Murray.
Hello.
Nice to see you.
Nice to see you as well.
Should Truth and Consequences or whatever. She's a Scott, I'm a Scott, but we're not related as far as we know. All right. But she is a nurse practitioner.
I am.
Okay, but with the topic today, when it was given to me, was we were going to talk about advanced practitioners.
Correct.
And I think everybody's first breath afterwards is, what the heck is an advanced practitioner? I'm used to a physician's assistant.
Correct.
Or a nurse practitioner as yourself.
Yes, sir.
Are they all one and the same?
They are and they aren't. So advanced practitioner is a broader term for a physician's assistant or a nurse practitioner that we use especially at GBMC, since we do similar, almost identical jobs, but have different backgrounds in education and experience coming into this realm. And so the advanced practitioner is the term that we use to kind of make us a little bit of more of a family name, I would say, or as a group within GBMC.
So the advanced part is?
That we're advanced practitioners, meaning for myself, I'm a registered nurse. I'm also mastered prepared, and I am able to see patients like a physician and write prescriptions as well. So that makes me more of an advanced practitioner than just being a RN. For a physician's assistant, they're also trained more extensively under more of a medical model, and they're able to see patients, see them similar to a physician in collaboration with physician, and write prescriptions, diagnose and treat patients as well. So
you threw in another term there that I was
I did. I'm so sorry. What was that?
Also not familiar with.
Sure.
You said you were a nurse practitioner and a
registered nurse.
You used
RN.
I think you used another phrase in there too.
Mastered prepared?
Yes.
Yes, sir.
Oh.
So a nurse practitioner does require getting a master's degree in nursing in order to become a nurse practitioner. So usually to become a nurse practitioner, you're a registered nurse first. Many practice for several years as a nurse, and then they'll choose to go back to school to get their master's to become a nurse practitioner. You can become a nurse practitioner in many different fields, between acute care, which is usually hospital inpatient based, adult health, family health. Some go into psych health as well.
Okay.
NICU or neonatal is another realm that people also choose to go into. And that's usually 2 to 3 more years of training. And then there are also programs out there where you have a bachelor's of science degree in another field and then choose to go back to school to become a nurse practitioner. There are RN accelerated programs that go into a master's program in one, so that they usually aren't practicing as an RN first, but do have their registered nurse have taken their RN boards and then become a master prepared nurse as well.
It all begins with being a nurse.
Yes, sir.
Do you have to spend time as a nurse before you can become
a nurse practitioner? Not necessarily. So for myself, my undergraduate degree is in foods and nutrition as a Bachelor of Science, and then I pursued a master's degree to become an adult nurse practitioner. During my first year of schooling for my master's, it was a fast-paced registered nurse program, and at the end of that I had done all of my clinicals, so I had spent time on the floor being a nurse and trained as a nurse. And then during my second year, my master's preparedness for it, I sat for my nursing boards and passed them to become a registered nurse, and then completed my master's degree. And graduating with the Master's of Science in Nursing, and then you have to sit for another exam to certify as a nurse practitioner, which I did shortly after. Lots of tests.
Lots of tests, but no residency like doctors go through.
Not so to speak, not graduating and spending time as a resident or fellow. No, you have that training during school where you spend 500 plus hours in the clinical setting with a physician or another nurse practitioner precepting you. And same with becoming a physician's assistant. They also go through clinical hours where they come in and spend a certain amount of time in different rotations, almost 4-5-week rotations in different topics between family medicine, internal medicine, surgery. That's more the physician assistant piece. Where the nurse practitioner, it depends on which track they chose. So if it was a adult nurse practitioner, you spend time in different, whether it's geriatrics practice, where you spend time in internal medicine practice, a certain amount of hours with a certain amount of preceptors.
Is there horizontal mobility? Can you work in geriatrics for a year and then go over to something else just by walking across the hall? Or
you could, but it would take some training. So most adult, for example, myself, adult nurse practitioner, you have this primary care plus medicine-based knowledge. You can definitely specialize. I spent time in gastroenterology for quite some time, and others. I've also spent a little time in oncology, and now I do more of surgery and internal medicine here at GBMC on the inpatient side. So you can it's very versatile. You can make it what you want, which is kind of nice, especially it's different than being a physician where they usually go through school and they specialize and they stay in that role. We have a little bit more flexibility about what we want to choose to specialize in or make it broad as we want to.
Cool. Take a moment to tell our audience something they already know, and that is, of course, if you are interested in asking a question of us or getting something clarified, you can do it by talking to us on Facebook, and those questions will be relayed to me. Now, we've all been to the doctor.
Yes.
And yourself included.
Yeah.
And you think you're talking to a doctor. Mm-hmm. And then you get a prescription and it says PA or NP
Correct.
on it. So, or I guess now AP.
No, it would still say PA or NP.
Okay. What's the difference between a physician's assistant and a nurse practitioner if they're both doing the
same thing? So the physician's assistant education is actually built under the medical model, whereas the nurse practitioner is built under the nursing model. The physician's assistant is managed under the Board of Medicine, and we're managed under the Board of Nursing. The difference is a physician's assistant, the training is a little bit different than the nurse practitioner training, but they also have to have a supervising physician. The nurse practitioner does have a little bit more independence, as in the fact that we don't need a supervising physician to run a practice, like an outpatient practice, or to see patients on our own. We do still collaborate and work very closely with physicians, let me be clear about that, but we're able to have a little bit more independence as far as as our supervision is concerned.
So you could have a practice of your own in a building of your own and not have a doctor above you?
Usually we have a collaborating physician that we have to reach out to if we have our own practice, and sometimes we'll use, in my past experience, have them review about 10% of the charts in order to make sure that we're making the correct decisions medically and practicing within our scope. But yes, we could practice by ourselves.
Is that a popular thing to do, to be a
There are a lot of nurse practitioners who do choose to do that. Healthcare is changing every day, and it is going to more of a advanced practitioner base to help deliver care to so many people when the physicians are being stretched more and more. So it definitely is something that is out there.
Key question, I guess, for somebody out there would be, does my insurance cover it?
Yes, it does.
It's the same?
Yes.
Okay.
It does, yes.
And you can do basically the same things?
As?
A doctor.
Yes and no.
Okay.
That's I collaborate on an inpatient setting. We collaborate every day with the physicians that are taking care of. So patients are admitted to the hospital. They have an attending physician, and we're there to support that physician. We're there to help medically manage them on the inpatient side. Any questions that come up with that patient's care, we're picking up the phone and collaborating with that physician. On the outpatient side, it can be a little bit different. You can have a different appointment with a nurse practitioner or a physician's assistant, internal medicine, for example, and they can go in for having sinusitis, and they're able to see you, treat you, and write your prescriptions, write the office note, and bill your insurance company independently. So it depends on the setting. We are not surgeons. We are not trained in surgery, though there are some physician's assistants, and even have a nurse practitioner that I work with who's a certified registered nurse first assistant who is in the OR with the physicians as well.
I mean, there are nurses in there anyway, right?
I know, yes, but they're able to first assist, to write orders after, and continue the care. So our role is just so versatile. We can do so many different things between inpatient, outpatient, and even in the OR. But the surgeons and physicians definitely have had more training and can specialize, and that's who we're going to and learning and training from, and also collaborating with.
In my personal sphere or whatever, I've gone to a physician for years, actually a dermatologist.
Yes.
And it turns out, through conversations with my wife, that I've never seen the dermatologist.
You've been seeing the physician's assistant or nurse practitioner, yes.
It's okay, she's pretty, so I'm fine. But, it came as a revelation to me that they didn't have to walk in the room and say, I'm not a doctor.
But they should tell you who they are. I think the conversation should start with, hi, my name is Hillary, and I'm the nurse practitioner who's going to be taking care of you today. Maybe I'm surprised they didn't tell you before your appointment that that's who you're seeing, so that you have some idea. But that happens. But that should be, I think, a conversation starter for any patient that's being seen by us, and explaining who we are and what our role is in the care. And
then, as I brought it before, you see the prescription form, and it says PA afterwards, and you're trying to figure out what's going on.
What happened? Who did I really see today?
You mentioned that there's an increasing role for this.
Sure.
In the healthcare system. Why and how much is it increasing?
Healthcare is an extremely busy place and very much changing. And for example, we've recently been working more with the hospitalists at GBMC. And as flu season starts, the census grows. We have sicker people. elderly population is growing. Baby boomers are also aging, so that population is also growing. And so with limited number of physician resources, we're able to come in and help deliver the care, effective patient-centered care, and supplement the physician as well. And I think that's where the growth is definitely coming from.
And I guess it surprises me, I keep going back to the prescription form, but that other people can write prescriptions.
Correct, we can. We've had a lot of pharmacology training, and we do continue pharmacology, continue education. We all can have CDS numbers, controlled substance numbers, and many of us can use I have my own personal DEA number, and I've been prescribing for the last 14 years. And yes, it is something that we're very much able to do.
Do you ever have patients balk at that or question it at all?
You know, not recently, not at all, no. I think when I first started quite some time ago, they were kind of shocked that we were able to do that, but it made it so easy and seamless. We make healthcare more accessible. When they're calling in, when I was an outpatient side, they were calling in for refills. They're definitely getting it a lot faster if we're able to address that than the physicians in clinic and too busy to handle it at the moment. We're able to help with that.
Perhaps we should clarify. When you say outpatient,
sure.
That means at a doctor's office?
Doctor's office, primary care, even going to see a gastroenterologist in their outpatient office. You go in, you have an appointment, you see the nurse, the doctor, and then you leave that day. An inpatient would be when you're very sick, admitted to the hospital, and you're there for several days because you have extreme, very sick, severe pneumonia, or that's just one example. It could be many things. Or you're having surgery. That would be more of an inpatient setting.
Okay. Is there an upward progression past advanced practitioner? Do people work up to that and then become doctors, I guess is what I'm asking.
Some do go back to school to become a physician. I actually have a PA in our group who actually was an RN first and then chose to go back to become a physician's assistant because she wanted to be in the OR and first assist and have those surgical skills. There are NPs and PAs who do choose to go ahead and go in to become a physician, but it is going back to medical school and doing residency and fellowship. It's still a long road. And then there are other ways for professional growth. Some people can go back and choose to go back to business school or even pursue administration roles and going into quality and can go into management. It just depends on what they're looking to do. And then also within, at least my group, we have developed a clinical ladder for procedures as well as those who are not interested in doing procedures in order to build their professional desires as far as educating their peers, educating students who come through. We do a lot of precepting of physician assistant students and now nurse practitioner students who are giving back to the community in which educated us. Okay. And orienting our own staff, educating nurses within GBMC as well, and doing project improvements to really help make healthcare just a better place. So there are ways to grow.
Once again, I'm asking for a definition. Clinical ladder. What
yes,
the heck
sir.
is clinical?
So I know, what is that definition? So it's more of a way it's the best way to think of it, to develop your profession. So if you practice for many years and you're really great clinician or an NP or PA, and you think, I want to grow professionally, but I don't want to go back to school, so to speak, you can develop this clinical ladder, I guess, is more of our professional model to grow. So writing for journals, professional journals within our organization, not our organization, but more of like the physician assistant journals or nurse practitioner journals where there's research done in academia. There's ways to, as I said, teach students and give the knowledge that we have gotten over the years in order to become a really great physician's assistant or nurse practitioner too. Some choose to become total parental nutrition writers, which is extremely complicated for those who are receiving intravenous feedings when they're unable to take food by mouth. And that's managing minerals and vitamins and nutrients, which is very complicated. And we have some people who've chosen to do that, so they're able to very much develop their profession.
That's quite different than a dietitian then? Or
they work with the dietitian very closely. So the dietitian's able to do it too, but they work together, as well as pharmacy. It's very much a collaborative effort.
When you mentioned pharmacy, I still haven't gotten over the shock of my pharmacist can give me a shot, but
yes.
that's another day.
Very much multidisciplinary, yes, absolutely.
I mean, you always think, a lot of people call their pharmacist doc.
Yes, they do.
And don't realize that there is a doc involved in there, but it's not an MD, obviously.
Right,
and then it was, several years ago they started giving shots.
I didn't realize they were. That's pretty.
I sometimes get my flu shot that way.
Very, very cool.
I got it this year at GBMC because
Did you?
I volunteer there, and it's just down the hall.
It was down the hall. I went and got mine as well.
Yeah, my arm's still kind of sore. But the first time my pharmacist asked me if I wanted my flu shot, I said,
You can give it to me?
yeah.
Very cool.
And I thought maybe a doctor was going to come in and do it. Can you tell me a normal day for an advanced practitioner or nurse practitioner? Or
Sure. I'll give more of an example. I'll give 2 examples. One from an inpatient standpoint. We come in the morning, and we usually have several physician assistants or nurse practitioners who work through the night to cover the patients in the hospital. And we give a handoff. So we give a quick report of what's happened overnight significant with each patient, if anything. And brief
this
history.
differs from what nurses, the nurses on...
They give report too, but it's a different type of report. So ours is more of managing, talking about labs, what medications may need to be adjusted, what procedures may be happening that day. They're similar reports, but ours is more on a management standpoint. The nursing piece, maybe to talk about when medications are due and those types of things, but ours is a little different than that. And then from there, we spend our morning going in and seeing each patient and doing an assessment, soliciting heart, lungs, belly, talking with the patient. And from there, taking a look at labs, taking a look at any medications they may be on, looking at orders, and as well as looking at any test results that have come back. And from there, trying to develop the plan. What's the plan of care for the day? What are we going to try? What are our goals for the day? If it's a surgical patient, how many times are we going to walk the hallway today? Are we going to be able to discharge this patient today? Changing medications as needed based on lab results and test results. And then from there, once we've developed the plan, we'll contact the physician to discuss the plan of care for the day and make any adjustments that they see fit. And then from there, we do some discharge planning and discharge rounds in the middle of the day in order to determine who's going home, and if they're going home, if any needs. Or do they need home care? Do they need physical therapy? Do they need to go to a skilled nursing facility? And then the afternoon, if you're on a surgical floor, you spend the afternoon seeing post-op patients coming to the floor, making sure that everything's okay post-operatively. And then at the end of your shift, you kind of rinse and repeat, I would say.
Okay,
You hand off to the night
Sure.
person. Outpatient's very different. As an outpatient, you usually have a standard schedule of the patients you're going to see that day from 8 to 5, and they could be patients every 15, 30 hour, depending on the new patient, follow-up patient, depending on what the need is and what the clinic is that day. And you see you're going in, seeing the patient, doing the physical and history with the patient, and making your plan, and then writing prescriptions if needed or ordering tests as needed. You also spend some time reviewing anything, follow-up tests and labs that come back from any patients you've seen prior days, and following up with those patients, working closely with the office staff and physicians as well, knowing that they're there if they have any questions that you may have.
Okay, I know one of the famous complaints of doctors, especially new doctors, which have a relative, is being on call.
Yes.
Is this a way to become an advanced practitioner and not be on call?
Yes, it is. It is.
To have a 9 to 5 day, or
You can, absolutely. It's very rarely. It depends if they want to be on call or not. For what I do, there is no call. They come in and they work their shift, and they're able to hand off that patient to the other practitioner, and they know that patient's going to be taken care of for and safe. There are some jobs as an advanced practitioner where you may have call. It all just depends on the role that you choose to go into. But yes, the benefit of becoming an advanced practitioner is there is not as much call, if any. Yeah, it is a benefit.
All right, GBMC has, I would
Yes.
imagine, a large percentage of nurse practitioners.
There are about 125 between GBMC, outpatient GBMA, and Gilchrist, actually.
Okay.
Yes.
Positions fluid. People go and come, and are there openings, I guess is another way of saying
Sure,
it.
there are openings. We have openings on the inpatient side for physicians assistants as well as nurse practitioners, and that's more the inpatient, so med-surg, internal medicine, as well as surgery, and that's more for acute care nurse practitioners and physicians assistants. There are outpatients as well as let me go back to the inpatient. I know there's also some OB and gynecology positions open. There's also Gilchrist positions, I believe, open. They've become growing quite a bit lately. Gilchrist has as an entity, and they're definitely needing more nurse practitioners and physicians assistants as well.
Okay. Pardon me for looking at my phone.
No, it's fine. You got a question.
That's how the questions come up. For inpatients, how often does the advanced practitioner change? if you have a doctor, you expect to see your doctor unless it's a group practice or something.
Sure.
But how often does it?
So we try for continuity of care, have the same practitioner several days in a row, and then we usually hand off to somebody who'll pick up after that. So it could be every 2 to 3 days, depending on your stay. You may have a new advanced practitioner come in and see you.
Is that not
standard?
Not a flaw in the system, but I mean, it seems like you could be assigned one person for the whole time you're there.
It does seem like.
Since you're
I know what you're saying.
You're running for the doctor or in place of a doctor. Yeah.
Correct. Right. And that continuity care, we try to keep the same person on as many days a row as possible. But again, at that, there are some groups within GBMC who have their own PA or MP with their group, and they're there Monday usually through Friday with them, and they're seeing the same practitioner. But for the most part, with some of the inpatient piece that we are covering, we are trying to see the same person several days in a row, and then once they've hit their 40 hours for the week, usually, then somebody picks up care.
One thing that's impressed me walking through GBMC from time to time, when you go into a ward, if they still call them wards or
ward unit, yes.
Yeah, okay, units. There you go. You see so many people inputting into computers on carts.
Yes.
And it's like when I last in the hospital, that didn't happen. But it seems like everybody's got their computer, everybody's got their cart. That includes the nurse practitioner?
Oh, yes. We're all very much connected to computers now, especially with the electronic medical record. It is how we communicate. It's how we order labs, drugs, document everything is definitely used from the computer. The carts are mainly used by nurses or nursing techs, and we use more of the computers that are at the unit, so to speak. Okay. So when I do walk into a room, it is just me and that's terrible English, the patient and I having an interaction. I heard myself say it.
I think you were correct the first time.
Having an interaction and actually talking, and then walking out of the room, and then, without the computer documenting after the fact. That way it's more personal than this electronic equipment always around. Yes.
Yeah, okay.
We're very connected to it.
Just impressive, because you have to also be computer literate, obviously, as well. But I guess that goes along with being a nurse or a nurse's
It's definitely
practitioner.
It's definitely a challenge learning a new electronic medical record depending on where you are, but it is also really enhancing care too, because we're actually catches medical errors. We're able to get labs so much easier. It does make having everything all in one spot, so we can take best care of you.
I guess I just wanted to point it out because it's not all warm and fuzzy. Person on person.
True.
You're doing an awful lot of inputting.
There is a lot of inputting, that is correct.
Okay, opportunities for advanced practitioner. We talked about a little bit.
Yes.
It was a fluid situation at your hospital or any hospital.
Correct.
So how does one find out about that?
About jobs at GBMC for advanced practitioners, it's gbmccareers.org, and the job opportunities are usually listed under physician's assistant or advanced practitioner. And there's also, those are the two big ones under there, and Gilchrist should be found on the same place as well.
But once again, you already have to have the education bona fides to go that way.
You got it.
It's not a nurse saying, I want to be.
No, they have to have gone to school, passed their boards through the Board of Physicians or the Board of Nursing, as well as and have a little bit of experience is always helpful too. Mm-hmm. So you're just not walking in cold. But we do take new grads. It's just everybody has to get in there and have a chance as well. But yes.
Okay. Let's say you've intrigued somebody who's not a nurse now and maybe is thinking about going into the medical field.
Sure.
So what would you have to say to a prospect?
So as far as I can talk from both ways. To become a nurse practitioner, if you have an undergraduate degree in something else and you want to become a nurse practitioner, there are programs out there that you can go from RN to MSN to become a nurse practitioner. There are probably some prerequisite courses that they'll have to take. Usually it's some sciences as well as maybe a psych course. Statistics is often included in that. For physician's assistant, there are also programs out there too. There are bachelor's as well as master's programs for that. So it's just a matter of finding the program that fits their needs that they're looking for to go back to school.
It's a satisfying way of life?
Yes. It is.
Well, tell me. It
is. I'm kind of giggling because I think I had told the story prior that when I was a little girl, I was going to sell Tupperware and become a solid gold dancer. then I took up telling.
That came in order?
It totally did not. My mom was like, well, you have goals, thank goodness. But then I always told her I was going to wear a white lab coat, but I wasn't really sure what that was going to be.
Okay.
And then I became a candy striper as a young adult. And
Do they have those anymore?
I don't know.
Okay, I don't think so.
I don't think so either, but I did for several years, and I love taking care of the patient and the patient's family and caring. And I believe in delivering exceptional patient care at all times. It is something at the core of me. There's nothing better than making somebody feel better and cared for and knowing that you're doing a world of good for them, and seeing them leave the hospital or even in an outpatient setting, knowing that you've taken good care of somebody, and when they come back and hug you and thank you, there's nothing more satisfying ever. And I even get like teary talking about it now because it's something that I am not passionate about delivering exemplary care all the time to people who need it and deserve it.
Mm-hmm. Putting a plug for GBMC at the same time.
That's
part of their motto, right?
It is part of their motto. We take care of our patients as we would our loved ones, and that's exactly what we live and breathe every day. And I would say for anybody who feels that way, they should go back to school, become an advanced practitioner, because you really have the time to take and spend with these patients and listen to them and care for them. You got an extra few minutes, you can sit down and talk with them. It's not all medicine.
Okay. Yeah.
It's not.
Doesn't sound like it would be.
No. The computer, and all that's around too, but the important thing is really taking care of the patient and their family.
Okay, I always offer the opportunity. Is there anything you wanted to say that I didn't ask you?
So the other thing that is very exciting is actually starting this Friday is Physician's Assistants Week. So if you're at GBMC and you see a physician's assistant, please wish them a happy PA week. Well, celebrate what a great job they're doing. At the end of October we're celebrating Advanced Practitioner Week.
Okay.
To combine the MP and PA, because Nurse Practitioner Week, I know it's so confusing, so many letters. Nurse Practitioner Week is in November, so we're trying to celebrate both roles at the same time, so that you'll see that at GBMC in the next month, which is exciting. And we are currently recruiting, so we'd love to have some people join our team who are advanced practitioners.
And how would I pick out a nurse practitioner or advanced
I should have worn my badge. We have big badges that say nurse practitioner or physician's assistant on the bottom. You'll definitely see them walking around, often wearing lab coats, white lab coats. They look similar to physicians probably, but we do have badges that label us similar.
As a volunteer, I'm still learning that the long white coats are doctors, short white coats are
the medical students. You got it.
And different colors and things. So I'll be looking for a PA. AP.
Just say AP. AP.
And NP.
AP, our scrub colors are maroon or wine color, so you can also pick us out that way.
Hillary Scott-Murray, thank you very much.
It's
been a lot of fun.
to you.
Yes. All right. We'll be back, of course, soon on Facebook Live, so we look forward to seeing you then. I'm Don Scott. See you soon.